Hello, Muzaffar, can you hear me? Muzaffar, can you hear me? Um, Barnabas, can you hear me? In case anyone hears me, you can unmute and then talk to me. Juan, can you hear me? Isaac, can you hear me?
I can hear, though a little bit of breakages, but personally I can hear.
Hello?
You can hear.
You can hear me? Okay.
How about there? Isaac, how about there? Hello. Can I be heard?
We can hear you.
Okay, let's wait for a forum and then you can start it off. So you're all welcome. It's me, Dr. Yob. It's me, Dr. Yob, and Dr. Saeed, your routine presenters. We're trying to get another presenter engaged. We're in engagement of another presenter, probably from away from here, and we shall get to. We shall let you know about the arrangement. So today, as you already know, we shall go into chapter 3, which is our concentration. So I think you have lots of questions. So what I'm going to do when we make a forum, I'm going to make sure I do a quick review or a quick discussion throughout the whole PowerPoints, and then I'll give you more time for questions. You get it? So you can prepare your questions, and I'll give you more time. I'm going to just go through research designs, and you'll ask. More of the time will be given to you, since it was your concentration. So let's wait for a quorum. We are going to wait for 5 minutes. It's just 2. Anyone with any concern, you can raise it as we wait. You can unmute and then you say something. I've seen Muzaffar's face out. Muzaffar, are you fine? You can raise any comment.
Yes,
Are you guys learning from this session, or you ain't? And what do you think we could adjust? Yeah. The registration form will come in later. Dr. Said will submit it to you. So the registration will come in, not now, but it will be sent to you. Worry now. Okay. It's 1 minute remaining, and then we can start it off. We may not wait for the whole congregation. Mr. Matovu Deo, how are you? Deo is on the road, and at least he gets some time and then listens to the sessions. That's great. Yeah, that's great. That's great. Yeah. So we have only 1 minute remaining, and then I can start it off. As I told you earlier, you can prepare your questions. I'm going to go through this session in a marathon. I think I'll take less than 20 minutes so that I can give you the rest of the minutes to ask questions. Okay. So right now, it's 16:05. So I think I can start it off. My name is Mike Ayub Hussein, and I'm not going to go much into the introduction of self, but today we are going to discuss chapter 3, and that's the research methodology. And basically for today, we are going to concentrate much on the study designs because they usually disturb some people, and we shall still discuss some other concepts of research methodology, like sampling, inclusion, exclusion, and other things. So study designs. So study designs are divided into, we have observational study and also an experimental study. So experimental study, those are interventional studies, like studies of drugs, studies of devices. Then we have observational studies, which can also be divided into analytical and descriptive studies. Descriptive studies are studies for that they cannot provide associations. They are not inferential studies, so they can only describe characteristics, phenomenons, outcomes. Okay, give an example of a study where you want to know. Let me give an example of height and weight. Okay, height and weight. So you want to see, is it that when you increase in height, you increase in weight? So you study that in males and females, and then you can describe that maybe in males, when they increase in height, they increase in weight, yeah, but in the females, it's like this. So you just describe it. You can also, we talk about the frequencies and percentages. But when it comes to analytical studies, which is an example of those studies, are cohort studies, case control studies, and cross-sectional studies. For analytical studies, you can infer association, the exposure, the risk, and also the outcome. And then the experimental studies we have, actually here I tried to make it randomized clinical trials, but we have different experimental studies. We have around 3. We have clinical trials, field trials, and community trials. Okay, but under clinical trials, which are mostly done, we have randomized clinical trials and non-randomized clinical trials. Randomized clinical trials, the subjects are divided into experimental and control. Okay, that's randomized, or what I think this could have been also controlled, controlled clinical trials and also non-controlled or experimental studies. We shall dive into that later. So let's discuss the cross-sectional studies. So cross-sectional studies are prevalence studies. They can give you the prevalence of a certain disease. You are able to study the prevalence of a certain disease, and they study the exposure and the outcome at the same time. So that's why they are they are mostly you'll find a word like snapshot studies. So snapshot studies are case control studies. The outcome, the exposure and the outcome are studied at the same point in time. So they don't usually present causal effect or causal associations, but they can infer an association. Okay, I don't know whether that is clear. I may say smoking is associated to TB. Okay, but I cannot say in cross-sectional studies that when you smoke you get TB. Okay, so I can infer an association, but I cannot. It is not causal. Okay. Then when it's they're usually selected based on the inclusion criteria. So you can say I'm going to follow up, or in my inclusion, I'll have all persons that probably have been. Let me give an example of a cross-sectional study whereby you be like iron when you're studying deficiency. Let me say like iron deficiency and anemia in mothers who are attending antenatal. So you're studying iron intake and anemia in mothers who are attending antenatal. So you're studying these things at the same time. Every mother who comes in for antenatal, you ask for the risk factors. Do you take iron? Do you take ferrous? Do you do this? Do you take this type of food? Do you do this? Get it? So you're not going to say in the conclusion or after your findings that mothers who take or who never took ferrous, actually, not taking ferrous is or causes anemia. Okay, that is a causal inference. But you can state in cross-sectional studies that not taking ferrous is associated with anemia. Okay, so that is the difference between causal and just an association. So for cross-sectional studies, they cannot present causal effect, but they can present a relation. Okay, I hope that's clear. So when we go to case control studies, which are these are studies that study rare cases. They study rare cases, and they study risk factors. So you compare two groups. One of the group has to be with the disease, and the other with no disease. So the one with the disease is the one called the control, and the one without the disease is the one called the case. So the usual case controls, can suggest a causal association, but they can't prove it. You get it? Let me give you an example of I did a case control study whereby I was studying antibiotics and their association to surgical site infections. So probably mothers who received prophylaxis were less at risk of surgical site infection as compared to mothers who never got prophylaxis. So that association could be causal, that when you don't get prophylaxis, you are at a high risk of getting surgical site infection. So that's a causal effect. And but I couldn't prove it, so you cannot prove that. But for cohort studies, you're going to see that we can have proof for that. We can have evidence for that. So the selection is based on cases. So you first select out your cases. You first select out who are the diseased ones. And then you get a comparative group that has no disease. And then you study those two groups comparing their exposure. Okay, so those are the case control. So when we go to cohort studies, the cohort studies these are incidence studies. They study outcomes. Give an example: if you're following up people who are smoking and those who are not smoking, and you follow them for 5 years to see who develops tuberculosis. So that is a cohort study. So, but we have retrospective and prospective. So this is this. So let me explain this. For a prospective cohort study, if today is 16, if I want to do a prospective study, I get a group that is exposed and another which is not exposed. Okay, but both of them are at risk. Give an example of a group of men who are aged maybe between 18 to 50, 18 years to 50, and some smoke, some don't probably smoke. And then I follow them forward in time, and then I see who develops tuberculosis after 5 years. Okay, so I'll ask them about their smoke. Were they smoking or they weren't smoking? Okay. So, and then at the end, I study the outcome. But for retrospective study, if today you're doing a retrospective study, you get those who are diseased. Give an example of those who have maybe TB or those who have died, and then you retrospectively follow up. Maybe you can use their records, okay, to see whether they had an exposure, they had a risk factor they were exposed to, okay, in the previous time, but you're studying it right now. And then you relate all those risk factors that were exposed to in the previous time to see whether they have an association to the present time disease that they have, okay? So it is different from a case control, whereby you just get those who are diseased and those who are not diseased, and then you compare the exposure, okay? Then let's go to experimental studies. I hope you can hear me. So for experimental studies, they are also categorized and classified. You can classify them as controlled or uncontrolled. So for controlled experimental studies, there is a comparison, okay? There is a group that got medicine and a group that never got medicine. So you want to compare both of them. This group, I gave them isoniazid and they were having maybe tuberculosis, and you give them isoniazid. And another group, you give them a placebo, you give them some other drug, okay? And then you follow them to see whether they get better. Then for uncontrolled, there are no comparison, there is no comparison group. So you just get people who are maybe diseased, and then you see whether isoniazid, disease with TB, and then you see whether isoniazid works on them. So when they improve, you'll be like, yeah, probably this drug works, but you have no comparative group. So we have also categories of experimental, so there can also be clinical trials, and clinical trials can also be categorized into randomized clinical trials, whereby the selection of the participants is randomized, okay? You select participants randomly, okay? And that reduces on the bias of selection bias. But also we have the non-randomized clinical trials, whereby you just select, maybe you come up with a day, and then you're like, on every Monday, I'll go and recruit. Every Monday, I'll go and recruit. So that is in non-randomized. And usually its results are usually biased. So I think you can see that image there. Let me see if I can put this down. So that image explains a case control, a retrospective cohort, and a prospective cohort. So if you look at that image, the first one, for a case control, the cases and the controls, you select cases, people who are diseased, and you also select another comparative group that are not diseased. Let me give an example. You get mothers who have surgical site infections on their operation site, and those who don't have surgical site infection, but both of them were operated. Okay, both groups, they underwent a cesarean section. So you start asking them questions about their exposures, okay, their risk factors or the frequency of the risk factors. So you ask them questions of like, did you do this? Did you take antibiotics? Were you did they follow aseptic techniques when they're operating? Did they use Savlon? Did they use this? So that is a pest control study. But for a retrospective cohort study, you get the disease frequencies. Let me give an example of like TB. In your present time, you get people with TB, okay? And then retrospectively, you're going to either follow their data, you get their files 5 years ago, you see their medical records, where these people exposed to, where there are any risks at one point in time that probably predisposed them to acquiring this disease that you're studying currently right now. And the difference with the prospective cohort, you get the risk factors. Give an example of smoking and those who are in smoking, and then you follow them forward in time for 5 years and then see whether they develop TB. Then for clinical trials, you get a drug like isoniazid used to treat TB, and then another drug which is not probably even effective, or just you can even just give them they can mold cassava into like a paracetamol tab, and then they give it to them as a placebo, and then you forward them, you follow them forward in time to see whether these people get better or they don't get better. So that is a clinical trial. So I don't know whether you can take a screenshot or I'll send this, but I wanted you to take a screenshot of this, and then you will answer it yourselves. So we have those diagrams, the diagram there. You'll use it to answer. I'll ask a question in the group. Okay. So I think I'm done. How many minutes are these? So it is, I've only presented for 20 minutes. Let me use the rest of the time to answer questions. Thank you for listening. So we've discussed study design. So raise your questions about study designs, and I will be able to answer them right now. So let's go. Any questions about study designs? Hello, just unmute and then you ask.
Okay, good afternoon. Hope you can hear me.
Yes, Rachel, I think I can hear you.
I wanted to get a clear difference between a post cancer study and a retrospective study. Is it only a matter of a difference between just the timing? And then in retrospective, in case you're looking for those factors that you want, did you look at records? Do you interview people? What do you do exactly?
Okay. I've noted that. Any other question? Any other questions? You see in the chat something about ecological study. Oh, yeah. So under descriptive studies, we also have ecological studies, okay? Whereby you study a group, a population, okay? But they are descriptive. You only study the descriptive part of it. They are not analytical studies. Let me give you an example. If you want to study, let me give an example of height. Yes, like height. Let me give an example of diet and obesity. Okay. So you want to see what people eat during the day and whether they get obese or not, and then you categorize that into gender. How is it in the females? How is it in the males? But of that population. Okay. So those are ecological and they are descriptive studies. So let me answer Rachel. Rachel, for a case control study, I'm going to give an example. If you have patients who have TB, tuberculosis right now, okay, and those who don't have, for a case control, you get patients with TB, okay, men aged 18 and 30 with TB, and then get those who ain't have TB. That is the control. So you start comparing their exposures, okay, the risk they faced previously. So you ask them questions about their smoking, you ask them questions about their lifestyle, do they drink, their work, occupation, get it? And at the end, you come up with your analysis, and then you'll be like, probably this predisposed them to TB. That is case control. Get the cases, get the controls, compare the exposures or the risk. Okay. Now, for a retrospective cohort, we usually look at records. Okay. You get people who already have TB right now, today. Okay. Or people who have already died right now, and you look into their medical records 5 years ago. You start checking up to date. Were they exposed to some risk factors or not? Okay. So it is different from the case control in that manner. Okay. That most especially for retrospective cohort, we look at the records. Okay. And we don't select in relation to cases and controls. We just select a huge population. I'm going to select people who are aged 18 to 30. Okay. Who have maybe TB, okay? Then I follow them back in time through their records to see whether they were exposed, okay? So that is a similar thing to this. I can use this image here that you compare disease incidences, people who have TB, then you follow them forward back in time. You ask questions about their exposure. You look for records about their exposure or their medical records, and you look out for the risks they were exposed to. Okay. And then you relate that trend for all that time previously up to now. You see whether it has an association to the disease happening right now. So if you've understood it, let me hear you say you have.
Okay, thank you very much. But now that brings me to another question. So
Yes.
for case control, is it one point in time? Because I understand for retrospective, you have back time, like it is
Yes.
a some period of time. So for case control, is it at one point in time or?
Case controls, they're a little similar to cross-sectionals. It's still, you're studying them at the same time. It's also like a snapshot, studying them at the same time. You're not following anyone, you're asking questions and studying both the exposure, the disease, and the risk same time.
Thank you. That's it.
Okay. Is that okay for all? So the link has been already sent by Dr. Said for you can register. I don't know whether there is any questions. Ecological studies are descriptive studies. I've already explained that, but you study characteristics in a population. Okay. So I want you to consider this. Let me give you this question and then you can answer me right now. So I don't know whether you can see that clearly on your screens. What is A and what is B? These are observational studies. What is A, what is B? For A, there is we are looking for the exposure, and in the middle there we have the disease, and the investigator is right now on 16 looking for something. He's looking for the exposure. Okay? And here there are two groups, the ones that have a disease and those that don't have a disease. So for B, the investigator or the research is in the middle there, and what he's looking out for is the disease at the end. But the subjects were exposed, and there are also some that aren't exposed. And then the C is the investigator is at the end, and he's looking out for the disease in the middle there, and people were exposed sometime, okay, sometime back. So can I have answers for this, please? Let's give a try. What is A, what is B, and what is C? So the answers should be 3. We are getting, I think we should be having cohort, introspective, and then we should be having the answers of a case control, prospective cohort, or prospective cohort. Okay. Can I have answers before we conclude? Or you will get into the chat and give me the answers into the WhatsApp group. A is case control, C is retrospective cohort. And your A case control, A is retrospective. Okay, let me see. A case control, retrospective. Okay, and thanks for the try. So let's do it like this. A, you're trying to study exposures. People have the disease and you're trying to study exposure. So that is a case control. Okay? You have already people who are diseased and those who are not diseased. And what you want to know is the exposures. Were they exposed? So A is case control. Yes, Rachel, you've gotten it right. So let's go to B. I've not seen answers for B. I've only seen, Rachel, you've said C is a retrospective cohort. So you're looking for the disease here and people were exposed. No, Rachel, it's not. C is not retrospective because for retrospective you must have people with the disease. Okay. You're looking out for the disease, people are exposed. Let me see. Exposure, B, and then you're looking out forward for the disease. Okay, B is a cohort study. Okay, and Rachel has gotten it right for C. So C is going to be your retrospective study. Okay, retrospective cohort. B is cohort because people are exposed, people are smoking. Okay, you have people who are smoking and those who are not smoking, and the investigator is in the middle trying to look forward to see whether they develop the disease or they don't develop the disease. That is B. Now for C, the investigator looks back to look out for the risk factors. Did these people smoke or they never smoked? And for those who smoked and those who never smoked, Are they having the disease right now or they don't have the disease? Are we together? So Rachel, you go to the number C, right? Number C is the retrospective cohort. Go into medical records, see whether these people see the exposure, look out for the exposure.